probably in one of our most difficult periods of time. So thank you very much, Lucy, for all your work that you've done for us, and we wish you very well for the future in Nottingham. So. And we look forward to seeing you on the telly still. Yeah? Yeah. Okay. Now, I've switched the agenda around a bit tonight, and we're going to take item 12 first, as it is a presentation. We're still, I have to say to you, we're still working the technology, so I want you to have some sympathy for the staff here who are working really hard to get this technology right. We will be streaming in the public arena, and once you switch on your button here, the camera will come to you to speak. I'm not taking any questions during the presentation. Paul will do the presentation, and then we will take questions, because that's the way we manage the technology tonight. Okay, so I hope that's clear for everybody. I also need to rename the item 12's title. It's actually called Send Re-Inspection 2021. So that's just to make sure it links in with what the presentation says. So I'm going to go straight now to the presentation and pass you over to Paul.
Okay, thank you, Chair, and good evening, members. It's good to meet you all in this forum. And when I the Interim Director of Education, I was very keen to meet with this forum to make sure that colleagues are cited on the SEND re-inspection process that we're expecting imminently. And for colleagues who are not aware, the SEND inspection process was put in place by the Department for Education and NHS England with a focus on looking at how effectively local areas have implemented the 2014 SEND reforms. The SEND reforms set out a suite of measures with a focus on improving the life chances and choices for children and young people with forms of special educational needs and disabilities aged 0 to 25. The Luton local area, and I say the local area, that consists of all partners across education, health and care, so including our schools, our settings, was subject to an inspection with regards to how well things were progressing several years ago. The inspection ended with the recommendation that Luton had 5 significant areas of weakness. As a result, Luton were asked to write a written statement of action. For context, 60% of local areas last year who went through the SEND inspection process out of 152 local areas nationally were asked to write a statement of action. So, as a result, we will be having our re-inspection. We anticipate over the coming weeks and months, and the reason why we anticipate it's imminent is that our colleagues in Luton and Leicester were subject to their re-inspections at the beginning of May, and from the original first round of inspections, Luton were 8 weeks behind those respective local areas when it came to having their inspections. So we're anticipating it sooner rather than later. So the purpose of me being here today was really to ensure that colleagues were cited, that this is an inspection that's coming up, and cited on the context and cited on, if you like, the parameters for the inspection. And as I said at the beginning, it's a local area review. It's not just about the local authority. So this is all partners across education, health and care. This is the whole ecosystem when it comes to SEND. So the local area, SEND is everybody's business. So the slideshow, it doesn't get into the details, it doesn't give you too much in terms of, but it does provide details available via clicks. Why am I here? As I said, to make sure that the board is cited. I have an obsession from my time working in the other local areas or working as an inspector that this forum, or this equivalent forum in other areas, would have what I call that clear line of sight. You're aware of the inspection coming up, and in terms of from governance perspective, you're in a position to be cited on it, but also ask those questions and bring challenge and bring support as well. So the inspectors will want to know, what's the role of the local Children's Trust Board? What's the role of the local Health and Wellbeing Board? What's the role of the local executive? What's the role of local partners in challenging and supporting the local area SEND improvement journey? So today is very much making sure that members of the board are cited, you're aware that it's coming up, and so you're aware So, giving a little bit of information, I gave the backstory. There was a SEND inspection across the local area, December 2018. The local area received the final letter from the inspectors in February 2019, and then there was a submission of what they call a statement of action. A statement of action sets out how you're going to remedy those areas of shortcomings. 5 significant weaknesses within the statement of action, and over 100 actions driving those significant weaknesses. During the improvement journey, the local area partners are subject to monitoring by our regulators. The regulators, for the monitoring purposes, are not Ofsted and the Quality Commission. They are the ones who carry out the inspection and the re-inspection process. The monitoring visits are undertaken every quarter, so every 3 months, by folk from the Department for Education and NHS England. And in terms of holding local area partners to account for how they're progressing and asking those questions with regards to what's going well, what's not going so well, are we moving at a fast enough pace? So, as I say, the re-inspections have started again. Luton and Leicester had their re-inspection first week of May, so we know we're not far behind them in the cycle. So in terms of the 5 areas of significant weakness, you've got that on the slide there, you can read it as well as I can do. So it kind of gives you a focus for what were the inspectors finding, what they felt the shortcomings in the local area were. So for those colleagues who have had sighting of the statement of action, the WSOA as the acronym, you'll see that the actions to drive improvements really focus around those 5 themes. I refer to these as the exam questions. So when I meet with colleagues across education, health and care, we have an obsession on how well are we progressing with regards to the exam question. Inspectors, when they return, thank you so much. Inspectors, when they return, I was about to project my voice even more, but inspectors, when they return, will focus on the exam question and progress against the exam question, and here you have them. In terms of, if I just move on from that, so the purpose of the visits remains the same, to determine whether progress has been made, and progress has been made at pace. We've had COVID, as we know. The pandemic has had an impact on the delivery of services across education, health and care. But the inspectors will not be allowing that to be an excuse. There's still an expectation that our children, our young people and our families with SEND haven't suffered a detriment as a result of the pandemic. So where there may have been slippage in the delivery of services or formal easements, as government departments call them, what mitigations have partners across education, health and care put in place to ensure that our children, young people and families are still accessing core services? The inspectors will cover, as I said, they will consider how local leaders have been adapting and adjusting plans, as I've said. Impact of the pandemic, crucial. When we look at how Southend and Leicester have had their re-inspection recently, yes, there has been the exam question that's been asked, and progress against those exam questions has been crucial. But the views of parents are important as well. And what's their experience of the SEND system? What's been their experience of the SEND system during the pandemic? The inspectors will be keen to meet with parents and carers. The inspectors will be keen to meet with children, young people and families as well. So it won't just be a case of the inspectors meeting with professionals as well. And in terms of the strength of collaboration, so when I think of my time working nationally and regionally in similar roles, I've been to some local areas where the local authority have been outstanding in this space and the shortcomings have come from the health side. I've been in some areas where health have been outstanding, where the local authority have been the weak point. I've been in some areas where schools and settings, their implementation of the SEND reforms has been the weakness within the system. So it's a case of making sure that our SEND system all comes together. And as I said, across education, health and care, schools, settings, colleges, early year settings, the whole system has to come together to make sure that our children and young people with SEND, their life chances and choices are maximised, as it were. So what does the inspection process look like? Well, Amanda, my colleague, is the Statutory Director of Children's Services, will receive the call on a Monday, and those calls take place on a Monday between 9 and 11 o'clock each week. So each week between 9 and 11 o'clock, a director gets the blessing, the privilege of receiving a call from Ofsted to say, we will be re-inspecting you in a fortnight's time. We then receive 2 weeks' notice. And the inspection team will come in, and the process will be a 4 to 5 day process. What we have to determine during the COVID times is how much of the inspection will be on site, how much of it will be virtual, so via Zoom and Teams and things like that, or will it be blended? as what's happened in Southend recently. Part on site, part virtual. In terms of the actual week itself, it will be a case of looking at data, there'll be face-to-face meetings, and the inspectors will look at progress against those 5 exam questions as I set out earlier. So week 3, as I said, the fieldwork week. This is the week really, you kind of get 2 weeks to get your stuff together, to send the information, to do your prep, making sure our parents and carers and children and young people are ready to meet with inspectors. So that's the fortnight before, once you've got the call. But the actual inspection week, you've got it now on this slide. You can see what that will look like. And it's possible that a number of folk in this forum here today may well be asked to meet with the inspectors. From a Health and Wellbeing Board perspective, what's your thoughts on the SEND system locally? How much oversight does the Health and Wellbeing Board have with regards to the work of the improvement journey? Of course, the Children's Trust Board are closer, and it's through the route of the Children's Trust Board. Normally these things would come up, but I'd be very keen, which is why I'm here today, that as a Health and Wellbeing Board, you do have a baseline understanding of the SEND improvement journey. In terms of current preparation activities, again, you have it there in terms of the slide. We talk about an impact report. So it's important that partners, stakeholders, officers talk about impacts. What's changed? What demonstrable improvements have there been for children, young people and families since the last inspection? Response to COVID-19 from the system. Again, this is an important part of the process. Have some areas allowed COVID to be an excuse for not delivering services effectively? Inspectors will be very unforgiving. They will be very unforgiving if there is a use of excuses why children and young people have not had services. We recognise there has to be some workarounds. There sometimes has to be mitigations. Sometimes services have to be done differently. But at the same time, we have to make sure we minimise the impact and minimise the potential for risk to children, young people and families as a result of services during the pandemic. Preparation of data. Inspectors are motivated by evidence. So my officers, my teams and our partners across care are putting together lots of evidence, lots of data. Stories with numbers we talk about. Do we know ourselves? Can we tell about progress against baseline? So 2018, December, the inspection took place. So by the re-inspection, what's the progress against baseline, against the 5 exam questions? So that data is important. Updating documentation on the local officer colleagues here. Hopefully you've had visibility and citing of the local offer, which is all very much the go-to, providing information, advice and guidance regarding SEND services. It's very much the front door to the SEND system. So you as a professional or a parent or a carer, if you wish to find out anything about the local area's SEND system and processes, the local offer website is important. And all local areas have a local offer website. And then in terms of updating documentation, as I said, and then review the local, in terms of website and out-of-date information, it's important that once we put this information on the website, that it's kept up to date as well. So what I find is some local areas when, if you like, just after the SEND reforms, they set up their local offer websites and they were fantastic, but the information very quickly becomes out of date, so it's important we keep information timely and up to date as well. So preparation now, what does it look like? I mentioned about evidence of impact. So we're pulling together an evidence of impact. So again, progress against baseline. Identification of data sets, so that's about in terms of education, health and care, progress, the data, attainment, exclusions and behaviour and surveys and lots of quantifiable data as well. And then in terms of confirming parents and children's ability to be involved, is very much, this is an important part. The views of children, young people and parents will be key. In terms of requests for managers and partners, so some partners here, this might be more relevant than some others, please share this slideshow with your teams and your partners. Prioritise work streams, and that's going on. Please prioritise requests for assistance, and some of you may be asked for information, dependent on what your role is, what you bring here. And it's important to undertake some field work as well. So if you do really want to get a deeper understanding of the recovery programme and read the reports and the supporting information, via the slideshow, you can click on those links and that provides you with more depth of information and also takes you into some of the areas that we're really focusing on. So this is a bit of a whistle-stop tour, SEND, the improvement journey, the inspection, but there is a lot more detail behind it there. In terms of colleagues locally across Luton Council leading this agenda, working with our partners in health and care, is Steph Cash, Natalie Jones, Michelle Wright and Linda Smith and so forth. So that really concludes the slideshow. Hopefully it gives you a deeper understanding of the improvement journey, the process, the inspection and really what the ask has been of the Health and Wellbeing Board. Thank you.
Thank you very much, Paul. Oh, sorry. Thank you very much, Paul. Are we okay to open up to questions? Fine. Are there any questions? Amanda?
Thank you, Chair. Mine's more of some additional contextual information just to take members of the Health and Wellbeing Board back, that clearly the kind of progress and update in relation to the work underway regarding the written statement of action has come through the minutes and activity through the Children's Trust Board, and we also, as a Health and Wellbeing Board, signed off the SEND strategy a couple of meetings ago and the SEND outcomes. So it's just sometimes holding the memory of some of the things that have come through to the board and how those things connect together. And in terms of the strategic leadership set of responsibilities that Paul alluded to, obviously the Director of Nursing for the CCG, Anne Murray, is the lead. And so very much connected in those respective leadership roles, with all key partners represented, which includes, adult social care, given the responsibilities of transition, and an ELF from a mental health perspective, Cambridge Community Services, as our lead provider as well. So I think, as Paul has referred to, those links on the documents, particularly our impact statement, is really important. And I think that part of what we have been challenged over the last 18 months because of the impact of COVID, and COVID having a disproportionate impact within our local area. So we know that, particularly on waiting times for children and young people within Cambridge Community Services, and some of our approach around engagement with parents and carers, is another area where we have received challenges during that period of time within COVID. So between Paul and I, very happy to both take any additional questions, but I just wanted to take the board back to the means by which we've received reports and the most recent sign-off of our SEND strategy and outcome documents that have come through to the Health and Wellbeing Board. Thank you, Chair.
Thank you, Amanda. Are there any other questions or comments? Javed?
Thank you, Paul, for that very useful presentation. I found it very enthusing to see. It was quite a lot of detail. So you mentioned about exam questions. So if you were a mock exam now, where are we today, or have you had a chance to review where we were, where we are, and if we had an offset inspection, say, tomorrow, what are the gaps that you perceive, and what are we doing to obviously tackle them ASAP?
Okay, thank you. That's a good question, and I know you're not going to be asking me to preempt and undermine forthcoming due process with regards to the inspection and tell you what the outcome was going to be, because we wouldn't wish to do that. With with confidence that colleagues across education, health and care are working hard, they're working diligently. There's been improvements against baselines in all of the relevant categories, so I'm comfortable in that regard. I'm having subgroup meetings, and we look at those 5 inspection themes, if you like. I've set up sessions just to, again, look at the data, have conversations with groups to evidence impact. So I'm confident that progress will be shown in all of those 5 categories. I can't say to you what the outcome of the inspection process will be, because I'm not going to do that in terms of preempting and undermining forthcoming due process with regards to that, but I will say to you that there will be progress against baselines. And there's some obvious wins in terms of our colleagues in health. We now have a designated clinical officer, a DCO, which is great because we didn't have one at the last inspection. We've got a fantastic SEND programme director in Steph Cash, who works across education, health and care and pulling things together. And we're getting some really good inputs from our partners in health and care. And in terms of, we've got some good strategic developments. My colleague Amanda has mentioned about the SEND strategy. So there's been some gains. But obviously the inspectors will come, they'll look at progress, they'll look at the metrics, they'll look at the numbers, and they'll take up with regards to the views of parents and carers as well. But what I can conclude with confidence that from my short time working with the local area, I've seen progress against baseline if we look at the data that's available.
Excellent, thank you. That's very reassuring.
Thank you. Any other questions from anybody? No? Okay, well, thank you very much, Paul, and we wish the inspection well whenever it comes. Yeah.
Thank you very much, Chair.
Thank you. I'm going to move you back now to the beginning of the agenda, and we move directly to item 6 and the update on COVID-19 in Luton. And that's over to you, Lucy. Oh, I apologise, yes. Could you tell us who how many you've had?
Yes, Chair, we received apologies from Michelle Bradley, David Carter, and Ms. Nicholson.
Thank you very much. And Robin, is it? We got Robin down there? Yeah. Okay, right. Over to yourself, Lucy.
Hi, well, good evening, everybody, and this is my last meeting, and I'd just like to start by thanking you all. I think it's the partnership approach that has meant that Luton has been able to deliver such a strong and robust approach. And when we talk about Team Luton, we're not talking about the public health team or even the council team. We're talking about the whole system in Luton that has worked together. And we've got some great examples of that in the work that we've been doing. We've had quite an interesting year in terms of our case rates. We started off very high at nearly 1,000 per 100,000, and then 2 months ago we had the highest rates in the country at about 100 per 100,000, and we dropped a couple of weeks ago down to 28 per 100,000. So a real change and a real drop in case numbers. Around about the time that we had our lowest point was when we began to hear around the impact of what we're now calling the Delta variant, the variant first identified in India, and how that was impacting particularly around Bolton, Blackburn and neighbouring Bedford. At about that time, we were about 95% the Alpha variant, or what was known as the Kent variant previously. And as of today, we are 92% the Delta variant. So a really big shift in a very short period of time between what was the circulating variant, the one that caused the big increase of cases at Christmas, into this new variant. And we are still learning about this new variant. What we have seen is in some places, it grabs hold very quickly and causes very high case rates. And that's what we saw in Bolton, Blackburn and Bedford. In other places, actually they've seen a large number of cases, but they haven't seen the big increase in case rates that some other areas have. And we're trying to understand what that dynamic is. However, in Luton, we have seen in the last week a really big increase in our case rates. And we expect to see a doubling within the week. So quite a worrying position from a relatively low baseline, but not what we wanted to see. And some of that will be this new variant, and some of that will be the opening up, the lifting of lockdown that we have experienced. In response to the variant, as soon as we were notified of cases, we stood up a variant and mutation outbreak management cell that met daily and reviewed each and every case. So for the first 2 weeks, we reviewed each and every case and took appropriate action. Sometimes that was contacting and doing enhanced contact tracing, and sometimes that was doing targeted testing, either for the setting or for a geographic area. But we, this week, having the case numbers that we've got, and so many of them being the Delta variant, we are moving back into a population-based approach, still obviously doing contact tracing and doing NHS test and trace, but stepping back from our health protection response. Having said that, we are prioritising areas where we see outbreaks, as we always have done, and taking appropriate responses. So we will continue to do enhanced contact tracing and targeted testing where we see any outbreak, not just those which are attributed to this new variant. The good news is that we have continued to see a decline in hospitalisations and deaths, And actually that is a national picture. And it does feel as though nationally vaccination has really begun to have an impact on these increasing case rates in terms of severity and mortality. Obviously for us in Luton, we don't quite have the vaccination figures that we would hope for. We have relatively low first dose compared to other unitary authorities, and that does mean that our population is perhaps more vulnerable, and I'm sure members of Health and Wellbeing Board will have seen the plea from the leader of the council to have surge vaccination in Luton, which we are continuing to advocate for our population, as I firmly believe that would make a significant difference, both in terms of transmission and in terms of illness. We mustn't forget that COVID is not just about hospitalisations. There are other harms with COVID, significantly around education and people's ability to go to work, people's ability to bring in income, which in an area like Luton, where there's deprivation and inequalities, can have a huge impact and a disproportionate impact compared to other areas. So keeping case rates down is still really important. We are redoubling our message giving around the importance of hands, face, space, and working very closely with our police partners to make sure that they, as the enforcement leads, particularly on mask wearing, support us in that. And also making sure that we can get testing as easy as possible, both the rapid tests for people who don't have symptoms, but also ensuring that we've got good testing options for people who are symptomatic. And I'm very pleased to say that our testing rates in Luton for symptomatic people remain amongst the highest in East of England. Our population, when they are symptomatic, have continued to demonstrate really strong participation. There is no sign of that dropping off. And again, that's one of the things that we've always been able to say about Luton is their excellent participation with the measures that we put in place. And clearly the other thing there is people's ability to be able to isolate when they test positive, and we are working very closely with our colleagues in customer services to look at how we could better offer isolation support, much more using local discretion, and we'll be extending that programme to be able to offer more isolation support for our population. And then finally, vaccination. We've spoken before about the open access vaccination clinics, which were so successful and were a real proof of concept, and I know that they've informed the response of the accelerated programme in Bedford. And we're working closely with the CCG to make sure that once the surge vaccination in Bedford is complete, we can very quickly and rapidly bring those benefits to Luton. We are, and Nina is here, and Nick is here, so they can talk more about that. But we're really pleased to see that pharmacists will be participating in vaccination as well, as that brings it closer to our community. So some good moves forward in that. Luton is leading the way in a couple of areas. So we will be part of a national pilot around contact tracing, which is a recognition of the tremendous contact tracing team within Luton Council. And we will also be one of the pilots for the delivery of travel data, international travel data, which has long been one of the challenges about us well understanding how international travel is impacting on our case rates. And Luton has been the big agitator for that. And so it's fantastic that we're bringing around that change and participating in the pilot delivery for that. I'll stop there, Chair, and I'm happy to take any questions.
Thank you very much, Lucy. Obviously open up to questions for people. Thank you for the full report. Any questions for anybody? Javid.
Hi. Thank you, Chair. Lucy, could you elaborate on the airport bit? Because obviously we have a lot of people travelling to see family members now, maybe going for a short break. What are we doing to manage, contain that they're not inadvertently bringing back COVID and spreading it?
At the moment, the travel sits with the national team, And that's one of the challenges that we've had, and that's the pilot that we're doing, is to better understand at a local level some of that circulation that we're seeing. We're all aware of the red, amber and green countries, and one of the areas that we've been advocating nationally for is some better comms around plan your holiday, book your holiday, plan your quarantine, so that people are well prepared for when they get back, that they will have to stay at home for that period of time. I understand the national team contact people on a daily basis and are working with a private company to go and do the door knocking on that. One of the things, so I sit on 2 national working groups for Amber and Red, and one of the things we're looking at there is how we could use our contact tracing team and our door knockers to support that, particularly where there are vulnerable people that might not be able to participate in the national, or where we've got some non-compliance, which actually might be around people not having the support that they need, that again at a local level we could offer. So we're still working through some of that, as it's been very nationally led. But I think in terms of international travel, the guidance really comes from that national body around particularly red and amber countries. And I'm sure colleagues will have heard today that nothing has been added to green, but Portugal has been taken off. So actually the ability to travel without quarantining is further reduced.
Follow-up question also on, so the mobile vaccination program, walk-in was very popular. I think that gave us how are we doing that? Is that likely to, no, we've got the bus still, is that likely to increase, and how do we maintain that?
I'm going to ask Nikki to come in on that one.
So the walk-in approach is something we're promoting, and it is a logistics. One, to make sure we've got available vaccine. So we are still, as a region, being really careful that the vaccine goes to the populations that haven't been, yet served. So taking that point of supply and then of the workforce, and it really is about working with our communications teams about making that clear. So we've got a mix, and I know that in Redgrave there are certain times for walk-in, and I think that's the discussion we've been having. We've got to try and make it really, really clear for the public, and that's like working with Health Watch, because it is confusing if you know it was walk-in at, on a Tuesday, but not on a Wednesday. So we're trying to make it really clear. So we're trying to get that mix. But our intention absolutely is to have that outreach, because we know, as Lucy mentioned, about the buses are very successful. And I think the other point to raise is that we expect by next week it will be the 18s, what we call cohort 12, but the 18-year-olds, and that will make our lives considerably easier. Yeah.
Just a follow-up question on that is, so that's good to hear that, because I think that the messaging needs to be very cohesive and very clear, so that we could get. And also, what are we doing around some care staff? That's still, what are we trying to do? Encourage care staff, because obviously that concerns me. That you would have thought the care staff would be more open to having, and yet that doesn't seem to be the case, and it doesn't seem to be a case nationally, which worries me.
So I think with Lucy's mentioned earlier when she started about this collaborative working, so Maud, my colleague, it's an absolute team effort. We have spent a lot of energy and a lot of effort of clinicians going into the care homes to doing some really bespoke work, and I know that Maud has worked with the managers. So we at the moment have, and are continuing to do that, influencing, negotiating, and clearly there's some political issues as to, that's a political issue as to whether they make it a mandatory. But we would encourage, and with Lucy as our Director of Public Health, support people. So it is concerning because the numbers are not where they should be. Yeah.
Okay. Phil?
Yeah, just quickly, what are the numbers in hospital currently? Just roughly.
I don't have those off the top of my head, but they are less than 10, and
Okay. That's
there
good.
weren't any in critical care.
Thank you.
Peter? All right, sorry.
Thank you. We're talking about going down to the next cohort. how are we going to be able to, because even when Luton Borough Council, we're adverting for people to come forward to have the vaccination, it's the AstraZeneca that we're offering, and those younger families that are caring are in that cohort that can be vaccinated are only being offered the AstraZeneca locally in Luton, and that's what I'm being told, and it's not Pfizer. Is that correct? Are they being offered both? Because I've had several families telling me that, well, look, and sending me the shot of Luton Borough, you know, of us putting out that those over 40 that want to be vaccinated with the AstraZeneca should come forward. So if we're going down the cohort, are we offering Pfizer, or are we offering others for them to be vaccinated? Because even today I had a phone call asking me, why aren't we being offered the Pfizer? We've only been offering the AstraZeneca. We don't want to have it done for whatever reasons.
I put it on. Yeah, so sorry, there's 2 vaccines that are available for the people who are 30 years and under. We are responsible to make sure that that is offered to them. And I go back to the point about the vaccine supply. So I can assure you, and Boots have been working on that, and I'm pretty certain it's today if I remember, the Pfizer is available. So what we are making that very clear, that on the, and this is where you have that little bit of confusion, so community pharmacists and what we call the vaccination centres, the Redgrave, and I know the Aspire's not working as much the hours, but you can book on the 111, the 119 number, and you can't book the wrong vaccine, all right? So if I was luckily, and I'm not, under 30, I would get a slot that would give me that I know that the Pfizer was available at that service, okay? But we are making that very, very clear with the GP practices. So Nina's practice, for example, they're continuing to offer, because they're one of the practices, that they make that very clear. Nina, you can take that one.
Right. You're just picking up on the vaccine. The most of the supply that's coming in now is Pfizer. In Luton hasn't had any Moderna yet. I understand it is in parts of BLMK. Well, that's okay. But I'm seeing Pfizer. The pharmacies next week is Pfizer. And Pfizer has to be for the younger cohort anyway, so we've got good evidence base for that. It is very popular with others who have hesitated about AZ. And I am very much of the view that actually, whichever one you will have, let's give it to you. Now, that may not be quite as national policy is, but that's very much how we are applying it. So if somebody wants the Pfizer and has not had a first vaccine, we will jab them in our site because we have enough supplies and we need to protect people. So just following on a little bit on the vaccines, we've heard of door knocking for quarantining, door knocking for contact tracing. Are we at the point of door knocking to say, the bus is down the road, you can have your vaccine down the road? Because it's surprising how many people I talk to who, however much communication has been put out nationally and locally, haven't come across it or can't read it or haven't heard it in the right language. So, if we really, really want our population, why aren't we getting to the point of door knocking in the areas that we know are low uptake? It maybe is a bit of a logistical challenge, but I think we could well have uptake like that. And it's very important for people to be convenient to them. Again, we've got shift workers, we've got people who live very, very busy lives. It's got to be easy to slot into that life. And if you look at some of the schedules, you're thinking, well, if I was doing 12-hour shifts 6 days a week, could I fit with that? Probably not.
If I may, I really endorse that view, and that links very strongly with the plea that Hazel put forward, which is to be able to vaccinate outside of JCVI, vaccinate people who present. And I know that the council would be able to support with the door knocking because we've got a team ready to go if we get those freedoms so that we are not having to age check people. That would be an amazing step forward and one that, was I still around, I would absolutely be advocating for. Thank you, Nina.
Just a last point, I think I welcome that approach. Maybe we could look at maybe having a Pfizer centre, so maybe Medici only offers so that people can choose, and the other one being an AstraZeneca or Pfizer. Yeah, that might help for the hesitant ones, because that's my concern personally. I think that might be an approach that might work. So people know that if they book for Medici, they're guaranteed to get Pfizer.
A conversation that I had today was around vaccine hesitancy with a young lady who wants to have a child. So it's just a question around whether we've explored fertility and vaccine hesitancy. So I know, for instance, a lot of people who are in the care sector, nurses, etc., will be in that stage where either they want to become pregnant or they're at that age. And the guidelines, as far as I understand, is that they can make that decision despite the political pressures, in order to safeguard their own potential fertility and pregnancy. So I just want to, because to me that's quite a significant thing, I think, that we don't really discuss in terms of a woman's right to, you know, follow her conscience with respect to herself and the political pressures. So I just wonder if that's been addressed, or whether we have any further evidence to say that actually it's not a problem being vaccinated when you're at that stage in life?
There is evidence. There isn't a problem. Certainly, you know, I can name one or two people who, from our staff, who were vaccinated and are now pregnant. So they're proof the fact that it doesn't affect fertility. It is the question that we get from time to time. So people will seek further assurance from a health professional they trust, and it's often their GP, to say, I'm holding back, what do you think? And the advice is always the risk to you and any potential pregnancy is greater if you have COVID than it is to be vaccinated. It's very, very clear.
Unfortunately, sorry, just to add, I don't think that message is getting out, because nationally you hear in the media that if you are in that situation, it hasn't been tested, therefore we don't know. So it's, you know, the responsibility, if you like, is taken away more from the individual. You know, it's kind of played in terms of you have a choice, rather than kind of trying to encourage them to go down that route based on evidence. So I don't think the message is getting out necessarily with respect to fertility and vaccination.
We have a clinical lead working on this work, and Kathy's here from the Bedford Hospital, so we've also, that person links in with Milton Keynes Hospital, but for us, we can certainly take that with the midwifery services, because she's done some of that work with the midwifery units, because there is a whole work stream of those exactly, so we've got a consistent message. As Nina said, if the lady presents at general practice, I think we're all fairly confident. And Sunita Chakrabarti is her name, but she has been working with the heads of midwifery. So if you'd like something specific, and I know she would really welcome that, so I'll put you in contact with each other.
I think that's fantastic, Nikki, but I think your question pertained to people who were thinking about conceiving and perhaps might not come into contact with those services. So one of the pieces of work that we've done is we had an FAQ session led by people from Black, Asian and minority ethnic communities who are professionals, experts in their field. And that was open to our population, but we're aware that not everybody could come along to a session like that. And so we are about to issue some really short videos, 1-2 minutes long, perfect for getting out through the WhatsApp groups and so on. And fertility is a big focus of that, because I think you're absolutely right. People have misheard and misunderstood the difference between wanting to conceive and being pregnant, and the risks that there are between the two, and we need to help them understand that. And there were some really fantastic answers of that FAQs that are really clear at getting that message out and come from somebody who speaks from a point of expertise rather than it just being me again. So we'll get those out very soon.
That's really reassuring. Thank you, Lucy.
I attended 2 webinars which have happened on myth busting, which I thought were absolutely excellent and really, really good. Now, I don't know because it didn't show how many people attended those, and I don't know how many. But if more of those could happen, I think that might help. But I mean, they were excellent from the people, from all perspectives, religious and medical, etc.
That's fantastic, and that's one of those webinars I was just referring to. So we'll happily organise more if they're of value, but we would like to maximise some of the content we got out of that before we organise the next one. But
Yeah,
thank you for that feedback. That's
I
brilliant.
think the important thing is to make sure people go to it.
Vicky?
I believe they're on our website, but I think it's an action for us to put them at places so we can signpost people, because yes, I've seen it and it was absolutely excellent. And I certainly know that's what Sunita has used in some of the sessions. So I think what I'll ask Sunita to do is to pull some of that together, exactly from your point. And it may be some other forums that are working on that we try and make that connectivity. Fab.
Thank you very much. That's really useful. Are there any questions? Javid.
Thank you, Hazel. So, in the South Asia, are we able to break it down? Because I suppose Sri Lanka came on the red list today. I think it was added to it. And obviously, if we'd put India maybe earlier in hindsight, maybe things would be different. I guess it would be nice if we can break that South Asia down into, if it is travel, that's maybe one of the peaks people are still travelling. That would be good to have that data. I think it's important. And also the messaging, because so I personally have rung a few people up who were hesitant and explained to them that, look, it could be the difference between, you may think you may get a few side effects, but the side effect of COVID could be the difference between life and death. I know it sounds very there, but the thing is, both of them went, and both sent me a copy of their vaccination jabs just to prove that they've done it. So I think it's very important that we keep that messaging up, that, you know, people understand, yes, you have a choice, no one's taking your choice away, but be careful of weighing up the choices between, it could be the difference between life and death, or long-term symptoms that long COVID could have. I think it's important that we keep that messaging up. Thank you for the report.
Just, do we know what percentage of the population in Luton are testing, i.e. self-doing, lateral flow, etc.? So proportionally how accurate are the figures is what I'm thinking of. And secondly, somebody told me that some people had got the wrong impression that if they had a negative result, they didn't have to report it. So how much is that skewing the figures? So how your figures and your percentages are only as good as the size of the test.
I think you're absolutely right on that. So we have really good information about PCR tests, really good information. And so we're able to understand, and we've got, and as I said earlier, you know, good continual participation in PCR tests. The move from coming to our test centres to people being able to test at home is very welcome in that it makes it more easy for people, but it does mean that we have lost that degree of control and understanding around participation, and we're absolutely aware that people aren't reporting their tests, either negative or positive. Now, it doesn't mean to say when they're positive they don't do all the things they need to do, but you know, they're not making that next step of registering it. And there's a whole range of reasons for that. Some lack of understanding, something to do with the complexity of it, something to do with the time, you know, because you've already taken the time to do the test and that final faff of having to do it. So there's a whole range of reasons there. I think what's worrying me most at the moment is making sure that people with symptoms or with a positive rapid test have a PCR test. And we've had a really great conversation yesterday with the Faith and Community Leaders Group, where we absolutely got that feedback that people like the convenience of a home rapid test, that it's in the cupboard and they can have it whenever they like, and so are not presenting as readily for a PCR test because they have to go out for that, or they have to order it and wait for it to come. But they don't always like rapid tests because of, you know, the reliability of them, or the perceived reliability of them. So we're in this slightly difficult position at the moment around testing. And so we had a conversation this morning, or rather yesterday, in our outbreak management cell around some extra comms that we're going to do around that. And we are participating nationally in the how do we remove the faff, it's a technical term, of reporting those tests upwards so it becomes easier for people to do. So it's an excellent observation. It's one that we are working on. For me, the reporting is really important, particularly of positives. I'm really keen that people test and take action on the results of that test, and that's the most important thing for me. And at the moment, the picture looks like people are. Because we are aware of cases, we can see the increases and we can see the testing participation, particularly for PCRs. If that was to change and vary, then my antennae would be worrying a lot around it. But at the moment, it's about making sure that people are doing what we need them to do and facilitated for doing it.
Yeah, I mean, I'm doing the test, and so I report that back. I assume that comes back to Luton as one of the Luton people. Because I just believe that the more you can do to add to the information and the data that people have, the more everybody can understand. Because I'm also doing the once a month Frankenstein antibody test, where I have to drain myself with blood.
And it appears in your health record as well.
Sorry?
It appears in your health
Yeah,
record as well, automatically.
Yeah. Thank you.
Thank you. So I think the NHS app is very good because I've tried it. Is there any way we can have so it's good that you were able to report it and I'm thinking we want to know when we get negatives as well as positives so that we can build the data, how many people are doing the tests at home. Is there any way they can email, because some people are struggling to record that even though they do the test, they probably don't record the fact that because if it's negative, they're happy that they're fine. But it would be good to get that because we've obviously seen a bit of tailing off that. Is there any way they can email it in the reference number or something from the barcode so we can log it ourselves if they can't do it themselves? Not possible.
I'm not keen on that idea. No, I think it has to go through the systems. What we need to do is make sure that the national systems are robust. The data, it's really important that the data has a single flow. That's one of the reasons that international travel has been difficult, because the data has been split out and therefore we've never got the full picture. So I think it's really important that what we concentrate on is making the current system as easy and smooth as possible rather than coming up.
Yeah, and I think that's the point. Is there any way we can do to make it easier for people to do it, to make sure that they are recording it? And also the COVID positive grants, are they still available for people who are self-employed? I think that messaging needs to be reiterated, that it hasn't gone away. If you're positive, you can still get financial help.
Anybody else? No? Okay, thank you. Can I thank you for the report? Thank you very much. And we were asked to note the recommendations. Is that agreed? Thank you very much. We now move on to item 8 and the Better Care Fund 21 to 22. Who's dealing with that? You, Laura?
This is going to be a double act.
A double act, okay.
So if there are difficult questions, Nikki will answer them. And I also have a phone a friend if there are some even more difficult questions, because Kate can't be with us tonight, but she can hear, hopefully, and will text me any answers. So we're making full use of the technology. So the purpose of this paper is to get sign-off from the Health and Wellbeing Board and to approve the Joint Strategic Commissioning Group's agreed allocations of BCF and IBCF funding for 2020-21 and really to acknowledge that it's going to be very difficult for us to monitor the benefits of that funding because of the impact of COVID. We are expecting annual planning guidance, which has also been delayed. We're now expecting that towards the end of August. And again, we will have to look at some of the impact of COVID and the work that we've been doing to really focus around prevention, working care being provided closer to home and avoiding admissions to hospital. The allocations have been agreed by the JSCG, which is a subgroup of the Health and Wellbeing Board, and reflect the financial pressures on the council and the system as a whole. So we have reflected on that and largely kept the allocations unchanged, and includes allocations to adult social care. We believe that this is the best way to spend the allocations and really to focus on some of the work around non-elective admissions to the hospital, long-term admissions to residential and care homes, the effectiveness of reablement and working across the system on delayed transfers of care. So that's just to recommend the recommendations in the report.
Okay, Are there any questions on the report? Are we happy to approve the recommendations? Agreed? Thank you very much. And I now move on to item 9 and the reports of the Health Inequalities Delivery Board. Thank you very much. Are there any questions on the report? Any comments? Happy to agree? I think it's to note, yeah, and the updates, yeah? Agreed? Thank you. We now move on to item 10 and the report of the Transformation Board. Is that you, Laura?
Yeah, thank you, Chair. You will recall that we have discussed considering some of the implications of the development of the integrated care system as part of our discussions at previous meetings, and at the conference we also discussed the relationship between the Health and Wellbeing Board and the ICS, and we talked about the concept of a place board. So this begins to start the thinking around the place board, which unfortunately the national guidance has still yet to be published. I was at a meeting earlier today where we are anticipating it might be published in June, which would be helpful. But we would like to get ahead of our discussions and start some of the thinking. So the first thing to note in this paper is that as part of the ICS CCG structure, Nikki Pillane has been identified as our Luton place lead, which is really helpful, with a very defined role about being our link through to the CCG ICS. And please forgive me, as I'm tending to use ICS/CCG as the same thing, although we're in this interim year. So that is really helpful. And then the paper is proposing that we have a strong place board that is really about bringing the senior leaders from an operational and delivery perspective together to really drive the agenda for integration and transformation across the system, with a strong focus on Luton, which is really, really important. We've also identified that it's really critical that we have a strong relationship with the five primary care networks in Luton, who we'll be working with to deliver some of that local activity, and particularly the alignment with some of our, from a council perspective, care services. So the board, the proposed place board, will continue the work of the transformation board, but with a changed emphasis. So we are suggesting that in this phase, the membership of the place board is the place lead for the CCG ICS, Nikki, the statutory officers from Luton Borough Council, so the Director of Public Health, Director of Adult Social Care, Director of Children's Social Care, myself as the Corporate Director, and the 5 PCN representatives, and the Chief Executive of Health Watch, to give us that feedback in from what our residents are saying. I think from the conference, one of the really insightful pieces of work was Lucy Nicholson's presentation of pulling together all of those themes of challenges and opportunities, and we want to feed that in. And then as the Bedfordshire Care Alliance is emerging, we are indicating 3 places for the Bedfordshire Care Alliance, or 3 of our key providers, to make up the initial form of the place board and to do the further development of our thinking as we move forward. The ICS revised structures will need to be in place for April 2022, but I think it's proposed that it is operating in a shadow form from September, and so it's really important that we get some momentum behind this. So you will see the recommendations in the paper are about moving to get our shadow place board in place quickly, and that you're asking me to make sure that that has an initial meeting has happened before the next meeting of the Health and Wellbeing Board, and that we welcome Nikki's position as being our place director. It's a really critical role for us, and that Health and Wellbeing Board are asked to support the core membership and the purposes that are outlined, and that we would bring back for ratification by the Health and Wellbeing Board the more detailed terms of reference when we've worked them up.
Okay. Are there any questions to the report? Are we okay? No. Nina.
Just in terms of relationship with other work that will need to be influencing and driving that operational work, I'm thinking in terms of the population health approach. So kind of a sub, or reporting from population health into place board, or perhaps it's something we need to explore outside, but making sure that we're driven by that population health data into the right arenas, really.
Yes, one of the things that we haven't got to the detail of, Nina, you're right, is about what other things and key areas need to report in that are a focus. So we are already doing some thinking around how we pull together some of the work at place around mental health, the same around frailty, and you're right, we do also need to think about the population health management piece and how we drive that. But we're still at that very early stages of the thinking. What I think is important is that we get sign off to the move to the place board here, and then we can do that more detailed work. You've got Nikki.
Thank you. I think the report, Transform Proportion, is absolutely very important. The only question I have, and I guess that's for Health Watch, is any chance we can get some statistics of who you're engaging roughly with monthly, what sort of engagement you're having with as a voice for the people, what sort of engagement, where the people are to see what you're picking up from, whether it's complaints about levels of service. Any chance we can get that report at some point?
Yeah, I mean, currently we've not got a lot of engagement going on with people because we can't do it face to face. So what engagement we do have is the feedback that people give to us through the telephone calls and or through the web, etc.
But I would still want to see that feedback, because I don't.
Yes, we've got that. That was presented to. Yeah.
Yeah,
I was away on that one.
yeah, we can we can send you the information, and actually I need to send out the feedback from the conference as well. But yeah, we can share that with you.
Yeah, all the numbers and data is there. Yeah.
Another question? Oh, Nikki.
I was really just going to endorse what Nina said about the population health work, and funnily enough, as one of Lucy's parting shots was about how we're passing that through to the team. So we will have a very focused, probably led by Susan Milner, on our population health at place level, because it's all about the Luton place, and it's only come out in the last couple of days. There will be a very bespoke piece of work required through the PCNs, which is called inequalities at neighbourhood level. So that's absolutely, so all of that feeds through absolutely beautifully. And it really is, looking through the ICS, the population health is the golden thread through everything. So we absolutely are informed that we're doing everything by the information and the data, not by what we think. So really, really just appreciated that.
Thank you, Hazel. I'd just like to say I really welcome this, because it's really important for the ICS that we build up from individual, neighbourhood and place to what needs to be done once, so that the top bit, or the ICS bit, is as slim as possible and as much as possible is done as locally as possible. So I really welcome, the energy behind this. Thank you.
I think I am. So this is just to reflect that Health and Wellbeing Board is a statutory board of the council, and that's why you're here face to face tonight, in that it is one of the meetings that is covered off by the legislation. And what we are trying to do is allow some freedom and flexibility during the year to amend the terms of reference of the Health and Wellbeing Board without having to go through the full process of taking it back through full council as part of the council's constitution. We have also looked at being clear about who should attend, and some of the changes in titles for us as a local authority. And we've also been a bit premature in starting talking about the BLMK ICS. We're in the transition year, and it should be BLMK ICS / CCG, and thinking about the role of the group. So you can see that we've added in some more detail about bringing forward the population wellbeing strategy, building on the work that this board has been doing on overseeing and overviewing what's happening on COVID, and building on the work that we again discussed on a COVID recovery plan, and pushing forward on that. So it's identifying the role of the Health and Wellbeing Board in a bit more detail, but giving us the flexibility about being able to change, reflecting that there will be quite a lot of work going on with the new legislation around the ICS coming partway through the year.
Okay, are there any questions on that, or comments or anything? We're happy to go with the revised governance arrangements. Obviously, it'll probably come back at some stage. Okay, so it's just for note really tonight. Okay, thank you very much. question I had, is there an item 12? Because I don't appear to have an item 12. We go to item 13, am I quite right? Oh, we did it with the presentation, wasn't it? Yes, right, okay, sorry, that's me. So we're on to item 13 and the work programme. And the suggestion is that the following dates are removed from the work programme because they were the COVID follow-up meetings. Am I correct there? And we're suggesting they are removed and we stick with the main meetings now.
Yes, so we're recommending, Chair, that we go back to being every other month.
Every other month, yeah.
And that will allow us time to and really have some focused agenda items. We can, of course, if we need to, have extra meetings to deal with any urgent issues, but we feel that we're probably at a point where we should go back to that kind of more every other month pattern.
Are there any questions on that from anybody? Are people happy to do that? Okay, agreed then. So I think I've come to the end of the agenda. Did I not get the minutes agreed? I've not done a very good job tonight, have I? I apologise to everyone. Yes, the minutes are before you. Are there any queries on them? Is it okay for me to sign them as a true record? Okay, that's great. And apologies for the mess I've made of the agenda this evening. Don't break down our new town council chamber, Conchita. We've just had it done. Okay, thank you everybody, and your tolerance tonight in our while we're still working out the new technology, and also for having to face-to-face meetings. I know that's not what every organisation is doing, but unfortunately local government has to. So we're great to see you all here. Anyway, yes, Phil.
Will future ones have the opportunity to do a dial-in, or?
Yes, we are. So our process was to get up and running and live streaming,
yep,
which we've done this week. Colleagues from Democratic Services are testing out how we can do hybrid meetings as the next development. So it's work in progress. This is all very new to us.
Yeah, no.
We do have to say though that because other people that do log in do have votes, yeah, there may be an issue around that process of it, but we're investigating it. Yeah.
Thank you.